All righty, good morning, everybody. Welcome to Minnesota Snow. And I'm happy that as many people have come in person as can, and I really appreciate that many would have wanted to come in person, but the department folks, I said, please just stay home and don't risk your fenders on behalf of this. And so another interim hearing. I think that interim hearings are a good idea. There's a lot to talk about. So this may be the last hearing that we'll be having interimly. Is that a word, Senator Hoffman? Interimly. I like that. And so the topics we've got today are really important ones with long-term care workforce, the 144G assisted living business, and the RCOs. Kind of a cleanup list of things that are still kind of open-ended, that are some challenges, and we'll be hearing from the departments and a good number of other good testifiers. I've invited Representative Noor and Representative Fisher to come. I think Representative Noor is here. He'll be chairing the sister committee to this in the House. And Mahmoud, are you there? I'd like you to say hello if you like, just to showing how that the House and Senate can actually cooperate on stuff. And you can greet us, and then later, is, from my point of view, you have the privilege of the floor if there's something you want to ask any of our testifiers. So are you there? Greetings.
Yes, I'm here. I have a limited connection. I just wanted to say hello. I'm honored to, join you this morning, and I look forward to hearing the conversation and also listening to the issues. So thank you so much for having me.
Well, it's really good to have you here. And so even though you're on Zoom for the first time since COVID, you'll notice the laptops are set up here, but they're not functional in terms of broadcasting. We're actually having a real hearing again with regular cameras and back to how it was. Once again, this committee, Senator Hoffman, is on the cutting edge. We were the last committee to meet before the old COVID shutdown. We were the first one to come back, and now we're the first one to be, we actually were the first, I think, hybrid hearing of any sizable committee. And here we are again now, cutting edge, breaking the ice into technology, because I am such a technology wonk. Senator Hoffman, don't you agree?
Mr. Chair, I do, and one of the things that I think I was already told to me that with something going on that our ratings are still up there where they need to be. But
they've got to be. We should get a kind of a post-rating thing, and I think if our budget's a little lean, we could actually charge a little revenue for advertising. Have different sponsors, maybe. Even.
See, this is truly you, Jim. I appreciate that.
Anyway, so I just want to, and so Representative Fisher is not on, correct?
I don't see him.
All right. Anyway, we do have a quorum. Thanks for the members who came, and we look forward to a robust discussion. I put Jake up here again, even though my computer's not on. He's looking a little bit worse for the wear. In terms of that picture, but the topic is no less important than before. I just want to reemphasize that, and to deal with the humanity of what this committee does is really something, and I'm optimistic about for the future. And when I was given the privilege to chair this committee 6 years ago, I never thought I would hold the gavel again, and it's been a real pleasure to get to be in this role, and one I'll savor for a long time. In the election, I didn't think it'd be that close, right, Senator Hoffman? I mean, you got like, what, 9 points? Yeah, I mean, who's the true fiscal conservative here? I did not pay for a landslide. Every dollar we spent, I feel like I was going to go on a cruise to London and wound up hitting an iceberg and wound up in Iceland and happy about it.
My daughter likes Iceland, by the way.
Oh, there you go. Yeah. So anyway, I'm just happy to be here and serve. And so after elections happen and powers change, Senator Hoffman, I think there's a phone book with all of your appointments on it. This is the list of my major appointments that I've got scheduled here with people that, oh wait, I'm sorry, that's it. So it's, but it does change. And I, for one, could not be happier about the selection of my successor. Senator John Hoffman, who is a very good friend and very passionate about this topic as well. So I think sometimes you think nobody can do as good as what you did, but I think he's even going to be better. And so I'm optimistic about that. So, so John, could you come here a second?
Wow. Thanks, man. Thank you. Very good. Thank you. Thank you very much. 2 years ago, Senator Abler, when you set out this committee, you made a commitment that if a bill was a good bill, if an idea was a good idea, it didn't matter who it came from or where it came from. The fact is, it needs to be talked about, it needs to be discussed at this committee. And in those 2 years serving as lead on this committee, not once did you mention Republican or Democrat, ever, in the conversation. And it highlights just the history of what the importance of this committee is, going back to our friend Jim Ramstad, who back in 2001, I'm not going to give you the history, but but he would always say, health and human services and education, you got to leave your ego in the hallway. And he said, your discussion is really what's the important fact at hand, right? Focus on who you're supposed to be serving. You did that. You've always done that. In the 23 years I've known you, that's always been a focus and a viewpoint that you've put forward. And you've never let the political bickering that goes on around the world influence the work that's at hand here in this committee. And this committee is a huge committee because of the fact we're talking about real people. The stories that you bring forward, the stories that folks bring forward are real people stories, because it's real people, and that's what we're about here. And so I've been honored to be your the lead on this committee and to be with you the last couple of years on this committee. And I think the commissioner said one time, it's not the Jim and John show, it's the John and Jim show. Well, and that was trying to be funny. My wife said, you know, you're not funny, so don't try to be funny. But, you know, that's, but it isn't. It's really about highlighting what's the important role for us going forward. And I'm honored that I've never seen this happen, where an outgoing chair gives an incoming chair the ability to do this. So with that, I'm grateful and I'm honored. Senator Abler.
Thank you, Mr. Chair. Thank you for those kind words, and you know, may God bless our work. I'm overwhelmed. Thank you.
Thank you. And so with that, members, we have Commissioner Jody Harpstead, who is, you're online, Jody. I didn't think I was going to make it in. Highway 10, for as much work as we did on Highway 10, it was brutal. But with that, you're going to give us an updated report. And members, you have in your online and also in your packets here the report on long-term care workforce. So with that, Commissioner Harpstead, welcome to the committee and look forward to your report.
Thank you very much. We'll get our slides teed up here. I'm impressed with your bravery going in. You have better snow tires than I do.
Thank you. And Commissioner, is your microphone, is there a way you can increase your volume on your microphone at all, a little bit?
I don't know.
Well, there we go. Thank you.
Okay.
Go ahead, Commissioner.
Thank you so much. Well, after last session, when our bill, as we all worked on, didn't pass, we have been monitoring the long-term care sector very closely to see how things are going, along with our partners in the Department of Health. And so I also have Diane Rydrick with me here from MDH, and she'll be presenting some of these slides as well. So we want to just present some data to get us started today on the state of long-term care and workforce. So next slide. First of all, just a reminder of the aging of the population in Minnesota. You can see the number of people over 65 and over, and how that will be growing very rapidly, of course, as it has been, but even more rapidly in the next years in Minnesota. Next slide. And this is the current trajectory of the disability waiver population, and you can see how it's been growing considerably over the decades and is projected to continue to grow too. Next. This slide was really helpful for me to see. It talks about how people in Minnesota are receiving support, and you can see that it's been 20 years since waivers and home care services passed long-term care facilities for the approach that most people want to use to live in community in Minnesota. Next. And you can see it here in a bar chart. On the left, of course, you have the nursing facilities and the disability residential settings, and then everything else is something in someone's home. Disability waivers, personal care assistance, home care, elderly waiver, and alternative care. And of course, we are sure experiencing this graph right now. This is from the state demographer, and you can see on the left, the years preceding 2015, the number of new entrants to the workforce in Minnesota, nice tall bar charts, and then the upcoming years and decades that we'll have with very few entrants to the workforce if population trends continue. Next slide. This is a piece we looked at in the middle of last session. I think we showed it to you then, but this shows job vacancies according to one of DEED's categories of jobs in Minnesota. And you can see the sudden spike in 2021 of job vacancies in healthcare and social assistance. Next slide. And we also just want to mention the average wage in the caring professions started in 2020, actually 21, at about 30% below the average Minnesota wage, while the average Minnesota wage has now risen 5.5% or so over the past year as employers compete for workers. And the wages in this sector are also an equity issue. You can see looking across all the caring professions from childcare to nursing assistants, PCAs, you can see the percent of that workforce that is Black, Indigenous, people of color, female, and the percent that actually use our medical assistance for their health care, and the percent that are on SNAP food benefits. Next slide. I'm going to have turn it to Diane Rydrick now to talk about the healthcare workforce. Diane.
Yeah, good morning. And thank you, Senator Abler. Thank you, Mr. Chair and members of the committee for having us here today and for giving us some grace for a snow day to not be in person. Even with an all-wheel drive Subaru, it was a little bit hairy at some points this morning, so we appreciate that flexibility. So just building off of Commissioner Harpstead's lead in, you know, one of the things we do at the health department is look at, calculate shortage areas for health professionals, and then for primary care, for dental, for certain other provider types, and it's based on national statistics and ratios of providers to population. What we see is that nearly all of our counties in Minnesota, in rural areas in particular, are in some degree of shortage for primary care and for dental, and in some cases for other professions. Next slide. And Commissioner, I think you and I might be trading off a little bit here. Is this one back to you?
It could be. This is simply looking at job vacancies in 2019 and 2021. Most of the categories are in healthcare, but on the right side, especially, you see the mental health and substance abuse counselors, which we've been talking about a lot since last session ended as well. And so you can see that job vacancy rates are up in most of these categories. Next slide. And we also know that the job shortage, the workforce shortage is more heavily felt in rural areas and will be in the next 5 years. This was yours, Diane?
I think so, yes. We're a little rough in our handoffs, sorry about that. So one thing that I think is important to note, although we're going to be presenting data here on long-term care and about different settings within that long-term care setting, all of the sectors within healthcare are really interrelated, and I would say beyond healthcare too. Shortages in childcare and in education affect healthcare as well. What we have seen really acutely over the last year or two is that when staffing shortages impact long-term care, that has a backup impact on hospitals who are unable to discharge people who no longer need to be in the hospital, but can't find a place in a nursing home or other long-term care setting or a group home. We see that short staffing increases burnout, and that exacerbates the problem. We get into a cycle where people are more and more burned out because they're caring for more patients, working extra hours, and that leads to more people leaving the industry. We see challenges accessing mental health inpatient beds and outpatient services that, again, can really exacerbate mental health crises or challenges that individuals are having, which can impact their parenting, their ability to participate in their life, their ability to work. We also see those challenges in non-emergency medical transportation and EMS, both the staffing shortages and how those shortages within EMS and NEMT impact ability to move patients around the state to what we call load leveling when hospitals are too full. Next slide. So I'll cover the next few slides and talk a little bit about what we see with long-term care, in particular nursing homes and assisted living facilities. So we'll have data in just a second on the number of nursing homes that have closed each year, but it's important to know that in the same way that, as Commissioner Harpstead said, the workforce challenges are more extreme in rural Minnesota. It is even harder to find people to hire in rural Minnesota. We have seen that play out in nursing home closures as well. Over the 10 years right up to the pandemic, the majority of closed nursing homes in the state were in rural counties, even though rural counties have relatively less of the nursing homes overall and of the population. So there's a 6% decline in nursing home beds in that previous 10 years in rural counties. I think it is important to note that occupancy in nursing homes has been steady to declining over the last 10 years or so nationally. So that's not just in Minnesota, but as other options become available to people, they often do choose that home-based care or community-based care rather than nursing homes. That really accelerated during the pandemic nationally. Nationally, census and occupancy in nursing homes went down significantly between 20 and 22. Next slide. So we at MDH do a survey every 2 months of nursing homes and assisted living facilities to assess how they're doing with staffing. And the colors are what matter here, but also the trend. So on the left, we have nursing homes, and on the right, we have assisted living facilities. One of the key questions we ask them is if they're able to accept new admissions. And you will see the green is the people who are just open for normal business. They can accept admissions as they did previously. They're not holding back on admissions based on acuity. So that green bar, we have not seen much movement for nursing homes since we started doing this survey. They were better in the summer, probably in part because you can get high school students and others to expand your workforce in the summer, but they're back down to just about a quarter being able to accept admissions as usual. And then most nursing homes are in that yellow block, which is only being able to take the less serious individuals, those who have low acuity. For assisted living facilities, they've been doing much better relative to nursing homes, and most of them are in a place where they can accept admissions mostly as normal pre-COVID. Next slide. The next slide is just quickly the same survey. It's kind of an overall picture when we look at all the questions on the survey and come up with sort of an overall score. How well are they doing in terms of staffing and ability to not just accept admissions, but sort of not putting too much pressure on their staff to work extra hours, number of vacancies they have, number of open shifts that they have. So again, same pattern, assisted living facilities doing fairly well, nursing homes really struggling, and very few of them being in that green zone. Next slide. So we have gotten a couple of questions about the number of nursing home closures per year and how that compares to pre-COVID. We do have some data going farther back, but wanted to show you the last 5 years. In any given year, we have usually 3 to 5 nursing homes that close for various reasons. Sometimes it's staffing. Sometimes there are old buildings, physical plant changes, and they just can't make the investments to get the facility to where it needs to be. Sometimes it's a smaller area and the population has gone down and the occupancy has gone down. So there are a lot of reasons. So on average, we've had 4 per year in the last few years. We have had 8 in 2022. Next slide. So as a companion to that, assisted living, just want to remind everyone, assisted living licensure is very new in Minnesota. We're only about 15, 16 months into this licensure process right now. And so you would expect a little bit of churn with a new license. Sometimes people get the license because it feels like the right path for them, but then decide that a different licensure might be right for them. Right now, we have just over 1,500 assisted living facilities that are licensed and 600 that are assisted living facilities with dementia care. In the last 16 months, since we started 15 months, we've had 114 assisted living facilities close and 17 of the dementia care, a smaller number that chose not to renew after their first year of license. But it's also important to note that at the same time, we've had new facilities coming in. So we've had some that decided that this wasn't the right path for them, the right licensure for them. They may have sought a different license, they may have closed, but in the same time period, we had 66 new assisted living facilities licensed and 5 dementia care facilities. Next slide. I think this one is back to you, Commissioner Herbsted.
Yes, thank you. So likewise, we wanted to show you, we had quite a bit of testimony last winter about the 60-day notice of closure when a provider of group home services is going to terminate an individual person's services. And that's what this chart shows. I'm sorry it's so busy, but it's got a lot of information on it. If you look at the blue tall bar in January, that was when we were having those hearings about a couple of providers who had given notice to quite a few of their clients that they were going to be terminating their services. And you saw that big spike there in January, because blue is 2022. So if you follow the blue bars all the way across the chart, you'll see what happened in 2022. And as Diane mentioned, we saw the same, we saw an immediate decrease in February back to pretty much pre-COVID levels. And it stayed there and came down through the summer, spiked a bit here in September, and then has come down again. And if you follow any one color across, you can see what a year looked like. And so we have been at fairly normal pre-COVID levels of termination of service notices, except for the spikes in January and September. Next slide. And this is a different view of group homes. This is from our licensing group, and this shows you licenses that have been closed and licenses that have been opened. Sometimes there's been information out in the media about group home closures without the information about group home openings. So we wanted to show you both of these. And you can see since first quarter of 2019, we've had a net opening of group home licenses throughout the quarters until the second quarter here of 2022, when there were quite a few licenses deactivated. But this has gone up and down a little bit and is not a huge trend upward. You can see the line chart at the top, which shows the active licenses in Minnesota. So that's about closures. And last winter, we were testifying about closures, and there was great concern about a spike and then an increase in closures. However, that does not mean things are stable in this marketplace. We still hear the stories of CEOs taking shifts. We hear parents supplementing shifts in group homes, parents picking up their adult children for the weekend when group homes can't staff. We hear concerns about quality of care with turnover and fewer available workers, fears about the small local senior facilities closing in favor of larger providers, and families having to travel distances to visit their family members. We hear that one EMT provider has stopped picking up members of Red Lake and White Earth who are on fee-for-service MA. And overall, I should say that after the hearings we had in the spring, we understand that about 70 EMT providers across the state stopped picking up fee-for-service MA patients, and one particular we've heard about from our tribal nations. Next slide. I would say a couple things we've been thinking about and talking and hearing is that providers may be more likely to turn over their services to another provider than to close. Out-of-state providers may well be looking to open or acquire services in Minnesota because of our above-average payment structures. You recently read about Caregiver of Texas opening and acquiring the services of Bridges, the disability provider. We do need a rich mix of service models to allow people choice and models tailored to individuals instead of everyone's in the nursing home or everyone's in a group home or everyone's in home care. We have a variety of needs in the community. We saw the chart where we've trended way toward home care in recent years. We know that we still have people who've lived in group homes most of their lives and are going to want to stay in them. And there will be people needing nursing level of care when families simply can't provide it anymore. And so we will need a rich mix, that's for sure, of models across the spectrum. And one thing I'm getting clear about is that we need to map the service locations that we have and strive to have services as close to home as possible so family can be close to their relatives. And that's the last slide, I believe. But if I could, I just wanted to add a couple of comments. A piece we didn't have a slide about. I want to just say that I'm feeling grateful this morning to providers of services for people with disabilities who go about quietly training DSPs and PCAs to de-escalate and manage behaviors with a focus on giving every person their best life. The issue of folks in the community with high behaviors is something we've been dealing with all summer and all fall. We've been walking alongside providers, helping them to find solutions. We've been trying to flex as much as we can to allow people to continue to serve. We've been working with providers to make sure that they're accessing county exception rates where feasible and keep people in business. And then the notion of folks with high behaviors is you're hearing about in hospitals where they no longer meet hospital level of care, nursing homes unable to take people because of their shortages, et cetera. And so we're going to need to move from this quickly put together kind of crisis response that we've been using for the last several months toward really brainstorming long-term solutions for people who exhibit high behaviors in the community and the very best way for them to live with us across Minnesota. So we'll be doing more of that work in the next months and as we get into session. And if I could also take just a moment, I also want to say that I'm feeling grateful for you, Senator Abler. You and I have worked together for many years now in service of people with disabilities and older adults in our community. In your time chairing this committee, there have been great strides in supporting people living full lives in communities. And to you, Senator Abler, and to Chair Benson and Chair Utke. Minnesota did a better job than most, as you know, in caring for people with disabilities and older adults through the pandemic, and grateful for all the waivers that we worked on together. And I'd also add that you have all been valuable members of my Commissioners Advisory Panel, working with me for the last 3 years to strengthen the Department of Human Services in our work. And grateful to all of you for your roles in working with me over the past 3 years. And Senator Hoffman, Chair Hoffman today, I look forward to working with you to continue the good work.
Thank you, Commissioner. Senator Abler, Senator Utke, those were nice words. Comments from you guys at all? And Senator Utke?
Thank you, Mr. Chair. I would just say thank you. It's been great working with everybody and with the commissioner, and I look forward to continuing. It's this job doesn't end; it just continues. So thank you,
Senator Abler.
Well, thanks, and just thank you, Commissioner. And I just want to return the compliment. I've worked with a bunch of commissioners over the years, and I think you have engaged in an extremely proactive way to engage with us. And I think if there was a class for incoming commissioners, they should look at what you've been doing and keep on doing that. So thank you so much, and thanks for the kind words.
Thank you, Senator Abler, and thank you, Commissioner. Are there any members, any comments, questions for the commissioner? Seeing none, I guess one of the things, and we'll probably get going on this too, Commissioner, is the slide that really jumped out at me was your interaction slide that showed really the work that we had done in this committee last year was the right work, and it would have helped stabilize some key points in the gaps that you showed in there. And the other one that really jumped out is when you start to look at the shift or the real work within the home and community-based services model, those folks that are getting their services or staying at home, it's important that we highlight. I think you just laid out for us some of the goals that we need to be establishing this next biennium within your presentation. And so it saddens me that, you know, our bill, which would have stabilized, that we worked really hard out of this committee last year and was the right bill to do. And I think that'll go for our conversation in a few minutes. But to see that there's still 53,000 plus vacancies within that is just really saddens, because that's important work for people and people at home. And so I appreciate your presentation on that. Representative Noor, are there any comments you need to make regarding the presentation or questions that you have from your remote location?
Mr. Chair, nothing at this moment. Thank you so much.
Thank you. And with that, I don't see any hands up.
Mr. Chair,
yeah.
I'm trying to get my hand up.
Oh, I'm sorry. I don't see your hand up. Senator Nelson.
Thank you.
You can't get your hand up. Raise your. Hi, Carla. How are you?
Hello. I apologize for not being able to get that digital hand up, but thank you. I just wanted to also thank the commissioner for the data. Data is always helpful. And I just wanted to mention a concern. I met with some of our group home administrators just earlier this week, actually on Monday. And there's a great concern, as you noted in the data, about being able to find employees to work in our group homes. And I just wanted to, some of the things that I learned are just that we already knew that, but some of the additional things I learned are really even more distressing. And that does have to do with the ability to pay the wages needed to get the employees that are needed. And we've seen that some group homes have increased wages up to $20 an hour, even though that's unsustainable with our state reimbursement. And maybe having some cushion of COVID dollars to last through that unsustainable period. And we've seen others at 20 was the highest, but some at $19 an hour. And it seemed like 19 was the critical point where they could begin getting the workers that were needed. But I just wanted to know about the sustainability of that. And just kind of, I know it's something we'll be dealing with next year, but I just want to make sure the commissioner was aware of that and see if she had any thoughts about going forward. We are probably maybe in the best place we're going to be unless something changes here, and it's not a good place at this moment. So I'd just like to hear from the commissioner for a couple minutes, please, Mr. Chair.
Thank you, Senator Nelson. I do appreciate you always come up with thoughtful. What about next? You're always thinking about what's next in there. Madam Commissioner, please respond.
Thank you, Chair Hoffman and Senator. Well, this is the issue of our day, the workforce shortage, and it's in every sector of the economy in Minnesota, not just this one. And we've showed some of the statistics about how there's a particular equity issue in this sector and how, of course, this sector supports so many people in our community who need support. And we'll have to be dealing in the next session with how many sectors of the economy we can shore up with the budget that we have. And of course, we always have those conversations during session about funding in the tails. And if we raise wages, there will be funding in the tails. And we'll have to be judicious about which sectors of the economy we're able to shore up in terms of wage increases, as we always have been, but particularly now with this workforce shortage. So it's an enormous issue, almost as challenging, perhaps as challenging as COVID itself, coming out of COVID and dealing with this workforce shortage in every sector of our economy. So there's no doubt that this sector could use higher wages and be able to hire more people and keep more stable in terms of its services. And then there are so many other sectors of the economy that need the same thing. And so making those trade-offs is going to be an enormous challenge this next session.
Senator Nelson.
Yes, thank you so much. And thank you, Commissioner. And I just want to be clear, my concern is about those wages for government funded entities. I don't expect the government to help fund workforce shortages in our private industries, but certainly when government is the payer of those services, it is an added concern. And so I just wanted to mention that. And thank you, Commissioner and Chair Hoffman.
Thank you, Senator Nelson. We're going to hear, as we're talking about this, it's Toby Pearson and Aaron Hubbard, both from Care Providers of Minnesota, Leading Edge, as they come up to the wonderful table. One of the things that dawned on me was in my conversations with some long-term care providers. I was out in Cokato, Minnesota, and of all places, and that the yellow tab that the commissioner showed about the folks that are only taking, those that don't have the highest needs, but those that their needs, it's because of the workforce shortage, Senator Abler, and Cokato absolutely is shutting down. They're barely hanging in. And this is out in, Dassel, Cokato, for crying out loud, the home of the Chargers. This is out on Highway 12 when you get out there. And it saddened me to see that there was open spaces there that they could definitely fit the need. And then to see the report from the hospitals, again, highlighting the commissioner, pointing out, where that other gap was. Folks then that are needing the most care aren't able to go. They're ended up in the hospital. 20% of the population, I think, at Mercy or HCMC are those folks that that came from nursing homes, that should be either in their home or someplace else. So with that, Toby and Aaron, welcome to the committee, and tell us what you know.
Thank you, Mr. Chair. Mr. Chair, members, my name is Toby Pearson with Care Providers of Minnesota. Today, on behalf of Long-Term Care Imperative, I will begin our comments and then turn it over to Ms. Hupert. Today, I will be talking about access to services, and then Aaron will present workforce issues that are presented in long-term care.
Can you hold on for a second, Toby? I don't know. Is your microphone on? Carla, can you give me a heads up, a thumbs up? Or Commissioner, could you hear Toby when he was talking? You did? All right.
Yes.
All right. Thank you. Sorry, Mr. Pearson. Go ahead.
As background, since the start of the pandemic, approximately 2,200 nursing home beds have been put on layaway or closed. To put that into perspective, it would be approximately 44 50-bed nursing homes. Over 400 of those bed actions have taken place since July 1st of 2022. This action is creating access problems for people in the community, and as we have heard from the chair, folks coming out of hospitals. And these actions are caused by workforce problems. In short, we are increasingly seeing that people aren't able to receive the care they need in the location they need. And I think you have some slides that we can walk through. So this is just kind of the background slide, what we're going to talk about, access and then workforce. You can move to the next slide. Access we'll start with. Next slide. The background, so we've been doing periodic surveys of our members. Obviously, we don't ever get all of our members to respond, but we get enough of a representation to kind of give you a feel of what's been going on. So the survey was emailed out on the 31st, closed on the 7th, and there's the respondents. So next slide. This slide is designed to show you two things. One is that 4 out of 5 nursing facilities have placed a hold on admissions. So that is the kind of the orange dot that's moving across, and then the occupancy is the occupancy percentage they are at. So the occupancy percentage in East Central was 76.5, and 75% of the settings in that area have placed a hold on admissions. So you can clearly see that they're placing hold on admissions even though they are not at full occupancy. Normal occupancy, you'd want to be running somewhere around 90%, but obviously nobody's running at 90%, and everybody, well, 4 out of 5 are putting holds. Next slide. Nearly all the nursing facilities that have placed a hold on admissions report turning away more hospital admissions. It's ironic because most of the time they would prefer to have the hospital admissions because usually Medicare is their first payer rather than Medicaid, and yet they are unable to take them. Next slide. The assisted living census is also, a lot of folks have asked about assisted living licensure and how assisted livings are doing. This one again demonstrates the occupancy and the holds. Again, you're seeing that even though they are not fully occupied, they are still having to hold on admissions. Both of these things are combining, so between assisted living and nursing homes, you're combining to have access problems for the folks in the local community, whether they be coming out of the hospital as previously demonstrated, or in many circumstances, folks from the community who now need services in a nursing home are unable to access those. So they have to go further to get them. Their families are put out by that access challenge. They are visited fewer times as a result. It creates all kinds of challenges. Next slide. So nearly 70% of the assisted living facilities that have placed hold on admissions report turning away more hospitals. That again syncs up with what we heard from the nursing facilities. So this is not just a nursing facility problem. This is also assisted living, any long-term care for seniors problem. Next slide. 1/3, many people ask us how many people in the assisted livings are actually on Medicaid. This tells you 1/3 of the assisted living residents are on the Medicaid waiver typically. Next slide. Typical nursing facilities declined nearly 15 admission referrals during October, so we have heard more from your hospitals about how they aren't able to get folks out of their facility and into long-term care. This is why more folks are declining the referrals because, as you go to the next slide, insufficient staffing is number one. Ability to meet specific needs is tied to your ability to staff. And then weekends, again, tied to your ability to staff. So they may be 3 different topics, but they are all really tied to one thing. We don't have enough staff to provide the services we need to provide to the individual that you're trying to place in our setting. Next slide. So the major findings, 3 takeaways for you. Staffing is key to admissions criteria. Nursing homes, 84%, and assisted living, 41% are reporting staffing is the challenge. Seniors were denied admissions on nursing homes or assisted living settings 11,000 times in October. Maybe a little deceptive because you don't know if the same individual was denied more than once, as in essence you're shopping around to try to figure out where you can place that individual. And many nursing homes and assisted living settings have wait lists for admissions. Despite having open beds, they do not have the number of workers needed to provide the services. And now I will turn it over to Ms. Hubert.
Ms. Hubert, welcome.
Thank you. Good morning. Erin Hubert with Leading Age Minnesota here on behalf of the Long-Term Care Imperative, and I will be walking through some of our workforce financials and operations. Go ahead to the next slide, please. So similarly, we had a member-based survey in August, and I'm going to present some of the findings from that data. The purpose of the findings in August was to try to better understand what are the driving factors that may influence a nursing home in particular to consider sale or closure. And so we'll shed a little bit of light on what that looks like. Next slide, please. I think if you look at the highlighted portions, what you will see is there is a lot of commonality in the driving factors that may influence a nursing home to consider sale or closure. And as Mr. Pearson has alluded, it all boils down to staff. There isn't a sufficient number of staff. Leadership teams are providing regular shifts on the floor. There aren't enough licensed staff to cover nights and weekends. They aren't able to provide wage increases needed to compete with other employers in their community. Or in a couple of instances, they have a physical plant deficiency that requires an expenditure of more than $100,000, which they don't have the means to provide. So whether you are considering sale or you are considering closure, there are some pretty common factors driving that decision. Next slide. So we really saw in the data two clear groups. Group one are those nursing facilities that are immediately considering closure or sale. Again, largely driven by staff. The other finding that we saw was that of those that were considering sale or closure, several were behind in vendor payments to either food, supplemental staffing pool, or a therapy vendor. The second group that we saw emerge from the data were those that had ongoing negative cash flow, and I would characterize them as at risk of becoming a part of that first group. Next slide, please. In short, without intervention, nursing facilities will continue to face significant hardship. Margins have improved somewhat since March, but remain negative. We believe that is likely due to DHS's implementation of interim Medicaid payments that has, if anything, provided some certainty to providers that they know what that interim rate may look like. Again, as I said, up to 20% of nursing homes are behind on payments to at least one major vendor. Almost 10% of nursing homes in Minnesota have exhausted their reserves and/or their ability to borrow to cover operations. And so when it comes to sale versus closure, what we observed was that sale was more likely in the metropolitan areas, and then closure was more likely in greater Minnesota. And as a representation, closure of 10% of facilities in Minnesota would equate to about 30 nursing homes statewide. In addition to some of those financial drivers, there are a couple of other operational things that I think a lot of our providers are working through, both in assisted living settings and in nursing homes. One of which, as many of you know, we have many employees who need to go through a fingerprinting and background studies process. And the legislature in their policy bill this past session did extend the deadline to get some of those emergency studies cleared to the end of the year. It would have otherwise expired in October. We're not sure how many individuals are still in that queue, but we know that we are experiencing some pretty significant challenges with respect to getting fingerprinting sites and appointments for many of our members. And I don't think that that's unique to long-term care, but what we know is there are closed sites, limited hours, not necessarily a vendor being available within 35 miles of a sort of population center. Anecdotally, I can share in the last week, I heard from providers in the Rochester area being unable to get a fingerprinting test, people in the Moorhead area being unable to get a fingerprinting test. So these are not really isolated communities. This is happening all over in fairly dense communities as well. And we know that DHS is struggling to handle the volume of calls that they're receiving, but it also means that there's longer than usual processing times to get those background studies back. We informally polled some of our members and found that over 60% of them were waiting 14 to 30 days to receive a completed background study, which I know exceeds what DHS is hoping to do in turning those around in 7 days or fewer. And I raise it not to shed any sort of blame in terms of what the challenge is. We understand that DHS has a lot of similar challenges with respect to staffing that we do. I raise it because when you're already at a workforce shortage and you're in a tight labor market, if you're not getting these things back and you can't get your staff to work because they don't have a background study, they're going to find a job somewhere else. So it compounds the staffing shortage that we already have. Similarly, it's not on the slide here, but I would raise that we are working with the Department of Health to get around 700 or so temporary nurse aides on the registry. I believe we have until August of 2023 to get that done. But that is also another example of an operational challenge that we're trying to work through amidst some of these financial and staffing shortage challenges. In sum, more than 20,000 caregiver positions are vacant in senior living. That really has not improved much, materially at least, in the last year. Our providers are doing all that they can to retain and recruit staff. More than a third of them have increased base wages by 10% or more in the last 2 years, and that's not enough. The average wage for a direct senior care worker today is $16 to $17 an hour, and that is largely driven by the state reimbursement rates. I think we all believe that this is a caring profession and should be recognized and compensated accordingly. Next slide, please. I think as Mr. Pearson alluded, and I think it was even mentioned in the presentation from DHS and from MDH, we have a growing aging population. In the next 5 years, Minnesota will have 50,000 more residents who are 80 or older than we have today, which I think gives me great pause for concern about how we will care for tomorrow's seniors when we are not able to safely and adequately care for them today. That concludes my remarks.
Thank you, Ms. Hubert. Is there any questions? There's a lot. Senator Utke.
Thank you, Mr. Chair. And this actually refers back to, we got some numbers and data from DHS and MDH earlier today. And if it was presented to us, I didn't catch it, but when they talked about nursing home closures, and you guys have now talked about it again, then they went into assisted living and group homes. We have closures, but we have additions. But in the nursing homes, are we seeing any additions at all, or is it strictly a negative thing? We're closing and just losing providers.
Mr. Pearson.
Mr. Chair, Senator Utke, there's a moratorium on building new nursing homes, so you won't be seeing any nursing homes added. What we have seen is two things. We've seen closure of wings, so rather than entire facilities closing, you'll close one of your wings or one of your floors, so you're in essence operating at 60% capacity or whatever number you choose. We will continue to probably see some addition of assisted living in different areas. The challenge will be, as I think the commissioner pointed out, trying to figure out on a map where those are going to replace some of the nursing homes that we're losing or the nursing home beds we're losing. How is that affecting access for individuals? For example, in your neck of the woods, is it in Park Rapids? Is it in Bagley? Is it in Detroit Lakes? Where are they actually going in relationship to the populations that need to be served? Does Waban need a nursing home or assisted living? These are the questions that I think increasingly we're going to have to address as folks need access. And as you know, the further you have to travel when you're up north, the less likely is you're going to go visit your loved one.
Senator.
Thank you, Mr. Chair, and thank you, Toby. It's exactly right. When we lose something in rural Minnesota, it isn't just to go down the street and take a couple rights and you're at the next facility. It's a lot of miles, and that is a problem. And as I saw those numbers coming through, I mean, we've all been living it the last couple of years. This just reinforces what we're hearing day after day. Is it's not good out there. And one thing that I always see was when you on here it had the sale versus closure. Yeah. And I go in the rural parts of our country, there isn't a sale option, I wouldn't think, because if they can't make it now, who's going to step up and buy it? Because it's just not something that you can make cash flow and make it work. So we've got to take it to the next step and figure out how to keep these doors open, because they are much needed.
Sounds like you're going to stay on this committee, huh, Mr. Senator Utke?
I will do it if I'm asked to.
Commissioner, your hand is up. Help us.
Yeah, just a couple bits about background checks, if I could. First of all, we have been tracking all of our background check sites in Minnesota every single week, reporting them to our COVID surge teams in the administration here. And we currently have just one site in Minnesota, in Bemidji, that's at over 85% capacity for appointments for background checks. So, and that red dot on our map has moved around over the summer. It was in St. Cloud for quite a while, and it's been in Rochester, it's been in Duluth, and right now there's only one site in Bemidji at over 85% capacity for appointments. Also, I can say that 85% of our checks clear within hours to 1 day, and 15% need further review. And what we are currently finding, and people are experiencing and you're hearing about, is the ones that need further review are the ones that take quite a while. Oftentimes we have to call another state to do part of the background check, and they're busy and their response to us is slow. always was, but in this workforce shortage, people are really experiencing when we have to do extra checks on someone given something that popped up in a background check, that's taking a very long time. But 85% of our checks clear within a day when there's nothing to discover. And so I appreciate the frustration of waiting a long time when there's something we need to check out. That's always been the case, but it's really acute right now.
Thank you, Commissioner. So as and I'm looking at the time, and we could have just spent an hour and a half having this conversation, Senator Abler. So I'm looking at the time. If there are any other, I guess the question coming forward is that, we all do better when we all do better, right? The we all is the collective statement. And just like, this committee has shown the last 2 years, it's not about politics at all. It's about, you clearly have concerns. You might have a solution. You might have a solution. Commissioner has the same concerns, might have a solution, That's kind of what we're looking for here, is going to be, what is the solution, right? And we all know, and we've heard this. We were the first, this committee was the first to start telling people years ago, right? We called it the silver tsunami, right? I mean, that was Toby, you remember this conversation? Yeah, I guess we're all getting. But, when we first pivoted, the more people 65 and older than in K-12 education, and now clearly with the commissioner slide that shows, it's 1 million plus, right? And then you're showing the Medicaid, Medicare, right? We're starting to see that push on the system. So I guess my question is, Senator Abler, help us understand, is there a need for these groups to really come together with a solution? Senator.
Well, Mr. Chair, I think the Senate actually did have a solution, and I think it involves spending some money. And, I know I'm the fiscal conservative, Mr. Chair. But this is actually a place that, one thing that we've succeeded in our work in the last 6 years has been to focus on the need, independent of the politics. And unfortunately, there's not a lot of politics in this niche. There's a strong policy with grueling numbers and overly excessive challenges and just the risk of collapse of an industry. And so so as I put this together and then turn it over to you, this is a way to continue the discussion. And so as funding ideas come forward, particularly early in session, or if there's ever a special one or something, to make sure this is on the list. We're not going to, we do have to move on, but I think in your private meetings and in mine, I think we really need to understand there's a whole bunch of money going into the system with all the inflationary, modes, especially in the nursing home side, but it's inadequate to fill the needs. And if you have all these places, if you have 10% that are out of reserves, and if other people are into negatives, they've mortgaged against the future, hoping we will do something. Yeah. And Mr. Chair, in a joint way, that's on us. And so anyway, I'll leave it at that. Thank you.
Thank you, Senator Abler. And with that, let's, Mr. Pearson and Ms. Hooper, thank you for being here. And Stacy Rowe and Ken Bentz, I think are you guys online, or Phil? I see Phil running around here. I don't.
Yes, Mr. Chair, we are online.
All right. Well, Mr. Bentz and Ms. Rowe, welcome to the committee. And I'm looking at time, and I'm sorry to be the time cruncher here, but I'd like to get through what we do and what we know. And can you give us a higher level of what do you know? Welcome to the committee.
Good morning, and thank you, Mr. Chair and committee members. For the record, my name is Stacy Rowe. I'm the Vice President of Vision Fulfillment with Mainsville Services, and I'm testifying in front of you today as the President of ARM's Board of Directors. So I found my home at Mainsville back in 2001, where they have blessed me with opportunities to contribute in multiple ways. And we currently support about 160 people living in a home that we own, 280 people living in their own or family home, and serve as the financial management services provider for around 900 people that self-direct their services. In addition, we offer behavioral and mental health services, person-centered planning, support for people to go to college, and employment supports. To do all of that, we employ around 660 people currently, and we have 105 open positions, almost all of which are in direct support. Moving on to ARM. ARM is a statewide trade association for over 200 provider organizations, businesses, and advocates dedicated to leading the advancement of home and community-based services that support people with disabilities. During the 2022 legislative session, ARM and our members shared the catastrophic impact the workforce shortage has had on people with disabilities and on the care and support they receive. I'm accompanied today by Ken Benz, ARM's Director of Research Analysis and Policy, and Ken will provide more detail on the numbers behind our workforce crisis. But first, there are a couple of important statistics I want to highlight for you. As you know, the rates for our services are set by state law, and well over 95% of revenues come through the disability waiver rate system. Currently, on average, direct support professionals earn just over $15 an hour. That pay, combined with the complexity of the work and the current state of things, it's not surprising that 30% of direct support professional job positions are vacant, which is more than 10,000 jobs, with a turnover rate of 45%. Not to mention that 66% of those DSPs who leave do so within the first year of employment. It is exhausting to continuously be training in new people over and over again. As you are hearing today, these statistics translate to real-world impacts. Providers do continue to close homes, or they're holding rooms and homes open and reducing the number of people that they support. Increasingly, individuals that have the highest support needs are not getting their needs met. And families looking for new services for their loved ones are faced with long waiting times or the inability to find a new residence when the current or previous home no longer works for them. There are multiple parents who need care themselves, siblings getting pulled from their jobs, trying to support loved ones at home and pleading for help. And we want to help. The viable choices for Minnesotans with disabilities and their families are diminishing. A perfect storm of workforce shortage, housing shortage, service rates that aren't competitive with the current market, combined with an aging population and an increased number of people needing services, is like leaving people in the eye of a hurricane waiting for relief for years now. Some people's lives have already been decimated. And while our problems have been growing for a while, as Commissioner Herbstead and Diane mentioned, over the last few months, we've been witnessing the negative impact that limited home and community-based options have on our healthcare system. Hospitals are full of individuals that no longer meet hospital level of care, but cannot find a home to be discharged to, or service providers who have the staffing capacity to support their needs. Many individuals are boarding at hospitals for months at a time, and others are getting discharged too soon from hospitals without proper supports in place when they leave, often returning to the emergency room multiple times. Also, on a recent call with national providers, we are hearing people with disabilities not getting the services they need and being unnecessarily incarcerated. Many people's lives are in turmoil, and we are seeing our system stretched and stressed at every single level. During the last legislative session, ARM brought forward multiple solutions, both short and long term, to help ease the staffing crisis. These investments, unfortunately, were not passed, and we continue to struggle to ensure that individuals with disabilities receive the services that they need. I urge you to support all of ARM's proposals and others that will be coming forward next year. We know there's no single solution to the workforce crisis, and money is not going to solve our problems, but increasing the disability waiver rate system payments is a start and the most pressing of our asks. We need sustainable investments in the disability waiver rate system that will allow providers to increase the wages of our direct support professionals. And let's be honest, at this point, we are losing good people at all levels of organizations in this industry without nearly enough new people choosing to enter the field. While I can appreciate that rates in Minnesota are better than some other states, they are not where they need to be. This labor market is a game changer, and we need timely support to adapt quickly, as well as long-term solutions so that we have a viable system in the future. We cannot continue to wait. As Senator Nelson mentioned, some providers are making the necessary investments now in wages and crossing their fingers, hoping that the legislature will provide the funding before they go out of business. Our support system for people with disabilities cannot weather this storm alone, and we need our elected leaders to act as soon as possible. We need you. On behalf of our members at ARM, their staff, the people they support, and families that rely on those supports, we want to thank you for your ongoing attention that you are bringing to this crisis. And for all returning and new legislators, we ask that you act quickly in the upcoming legislative session to pass meaningful investments in disability waiver services. Thank you.
Thank you, Ms. Bowe. Mr. Bentz, anything to add to Ms. Bowe's testimony?
Well, I do have some of the statistics to illustrate things that she has said. They're very much in line with everything else that you've heard this morning. And but I do want to talk a little bit about some of our proposed solutions, because as Stacy and others have said, this is a huge problem. It's complex, it's multi-layered, and I know that we sound like a broken record, but solutions have to start with increased investment by the state, and that's controlled by the legislature. We've been ignored and passed over for far too long, and we depend on the legislature for increased funding for these, because the wages people can earn at retail, fast food, and other entry-level jobs, especially as they've been able to increase them over the past couple of years, there's just no way that our sector can keep up. Some of the systemic issues, though, the benchmarking data that is in statute that's required to be used to set the wage components that Stacy was mentioning in the disability waiver rate system, they're always at least 3 years old, and therefore they can't be responsive to changes in the wage landscape like we've seen since 2019. And it keeps the employers in the disability services sector perpetually behind the times. The crucial workers that provide direct support and the providers who employ them, they need and deserve sustained increases in the funding formulas that establish the rates that we can pay them, which determine then the wages that they're able to pay their employees. The proposals that we brought forth in the last legislative session would still be impactful as first steps in addressing these issues. They included updating the data used to benchmark the wage values to be at least less outdated than what they are now. And they also allowed for more up-to-date inflation information to be used to update components that are subject to adjustments based on inflation. And they would fully fund the competitive workforce factor that helps close the wage gap between direct support professionals and other occupations with similar requirements. So to both of you, Mr. Chairs, we thank you for the ongoing efforts that you have shown to draw attention to what is happening to people whose lives depend on reliable supports and safe places to live. And I hope that everything that you've heard so far this morning are helpful to describe this ever worsening problem, especially in disability services, and the solutions that we so desperately need. So thank you.
You know, and thank you, Mr. Bentz. You of all people, I mean, I 20 years ago, you and I were on the maternal child, you and I were talking Title V public health stuff 20 years ago, and here, you know, we're still having the same conversation, system stuff. I really look forward to working with you and ARM, as well as the care providers and leading age in the future. So, Senator Abler, any questions for folks? Anybody from? And we're running out of time here, and I knew this was going to happen because
Mr. Chair,
that's
just to beat
how
the
it is,
drum.
Mr. Chair.
None of this is news. I wish it were news. This committee has been just leading in the charge to try to handle this, and that's why we're here again today, Mr. Chair. And so it does need more money. It does need to be supported. It is important. I know it's important to the administration, but I think that at some point it has to get higher up on the list for the administration as they bring forward their budget this next cycle. And I'm optimistic it will be but you got to keep talking to people, to the people that are in the audience and trying to survive out in greater Minnesota. Thanks.
Thank you, Mr. Chair. And with that, I think Dolores Flynn from SEIU Healthcare is online. Josh Berg, you're going to come on up. Dolores, can you guys help us with the time? If we know the gaps that are there and maybe talk about solutions. But Dolores, nice to see you again. Welcome.
Chair Abler and Chair Hoffman and members of the committee, thank you. It's good to be back here. My name is Dolores Flynn, and I speak today on behalf of SEIU Healthcare Minnesota and Iowa. Our union represents about 50,000 workers, including nursing home members and home care workers like me. I live in Roseville. 21 years ago, my adult son, Scott, who is 51, had a massive brain hemorrhage. He is complex care, receiving 24-hour-a-day care on PCA choice. He is dependent on others for all of his cares, and he is nonverbal. He cannot communicate what his needs are. He has a right to compassionate care with dignity and respect in his own home. Caregivers come into our home to take care of Scott. Prior to COVID, my role was to manage all of his cares. My husband and I would only fill in when necessary. Now, due to the shortage of caregivers, my husband and I, both 78, are full-time caregivers. This is not what we planned for retirement. We both have heart issues and back problems. My husband has really bad balance, and I need a knee replacement. I can't get the knee replaced because I don't have enough caregiver coverage for Scott. We moved Scott with a transfer belt. He is 6'2", weighs 176 pounds, and he can't assist, so it takes two people. My husband has fallen while transferring Scott, which means Scott falls also. We've had to call for help to get Scott back up. We've had neighbors help. We've called the Roseville Fire Department. I've had my knee dislocate when transferring him, which resulted in myself falling, him falling, or both of us falling. He's hit his head. He has many bruises. He's had sprains. He's even had a fractured elbow. But we're not alone. Other clients are also being taken care of by elderly parents. And this situation puts all at risk. Are these the programs that Minnesota envisioned and that we can be proud of? I have a question mark on that right now. What is to happen to them when we, the parents, are no longer capable of taking care of them? This work is stressful, emotionally draining, and extremely physical. We and others are just exhausted. If and when I can get someone to come in to interview, and I mentioned he is an adult that wears diapers, and poopy diaper changing is part of the cares, the response is, oh, hell no. Now I cannot even get a response from the advertisements that I put out on websites or in the newspaper. And that goes along with what everybody else has been saying, you know, staffing shortages. Going into a nursing home or a facility is not the answer. And that's obvious from the previous testimony. Scott's medical cares are such that he would probably die within the first 36 hours for lack of adequate care. It's like the disabled are not seen. Therefore, they don't exist. It's very frustrating, and I get extremely angry with the system and the politicians. Thoughts and prayers don't cover these cares. Caregivers have been sounding alarm bells to DHS and politicians for years now. But the money put into these vital careers is far less than other jobs. Recently, a group home, and I don't know the name, offered one of Scott's caregivers $22 an hour. If I could offer well over $20 an hour with benefits such as retirement or even overtime, a wage that people can live on, then I could attract and retain the help my family needs and other families need. Currently, myself and a group of other home care workers and clients are negotiating a new union contract. And we're trying to fix this. It's time to produce financial results that will help to reduce this shortage. I mean, that's kind of the main line of all the testimony today. Home care has always had bipartisan support, and we're looking forward to working with both parties to rally a substantial contract that caregivers can actually live on. You know, it's time that all the talk about this crisis finally results in a solid solution. You know, and just a reminder, all of us are just a heartbeat away from needing these cares. A fall, a stroke, a heart attack, a car accident. You know, I hope that together we can build and fund a solution that keeps disabled people and caregivers safe, that they can stay in their home, and one that we can all be proud of. Thank you for your time.
Thank you, Ms. Flynn. You remind us what Senator Abler has been saying for 2 years, right? All people deserve dignity, and even our seniors deserve some respite. And so, thank you. Josh Berg, Director of Accessibility Space. Welcome to the committee.
Thank you, Mr. Chair, and thank you for holding this hearing today. I'll be brief. This was my long original version.
Thank
This
you.
was my short version, and I've already crossed it off since I've been up here. So give me the yank when necessary. I'm the Director of Minnesota Services and Strategic Growth for Accessible Space, Inc., a nonprofit organization based here in St. Paul that provides affordable, accessible housing for very low and extremely low income individuals with permanent physical disabilities, brain and spinal cord injuries, as well as seniors and veterans across 25-plus states. We are proud to have supported individuals living in these affordable, accessible settings since 1978. Sadly, we've had this same conversation ever since I started in this field in 2011, and not much has changed. We have provided the same testimony, had the same legislative priorities, and the outcomes of these committees have resulted in the same thing, bipartisan nothingness. No significant or meaningful permanent increase to waiver reimbursement rates year after year, session after session. I'll give you one example of the inadequate reimbursement rates that we deal with daily. We rely on a complex framework that doesn't even account for any nursing time. So let me say that again. The integrated community supports and community residential services rates, that is the primary service that we provide at ASI, do not account for a single cent or minute of nursing time or resources, despite the fact it is not only best practice, but it is also required by the regulations that govern these programs. I'd be happy to sit down with any one of you, along with Ms. Harpstead or Ms. Merz's awesome team at DHS, to discuss this missing component, as well as the other critical missing pieces like transportation and other things that need to be considered. Now, we can sit and talk about the low unemployment rate across Minnesota and how all businesses, organizations, and communities are feeling the pain. I sit on the GWDB alongside you, Mr. Chair, and we hear this quite regularly. So why are we different? Why do we deserve something different than anybody else? We can't close up early. We can't open up late. We can't shut the doors for a few days if we don't have the staff to do so. It isn't just an inconvenience for us to not show up to work. Not showing up isn't a choice. Lives depend on us. Vulnerable lives depend on our organizations. Families depend on us to care for their loved ones when they cannot do it themselves, or they too must go to work. Individuals rely on our teams to get them out of bed in the morning, assist with going to the bathroom or taking a shower, making their meals, and even feeding them to them. They depend on us to deliver their critical medications timely and accurately. We must show up. And we continue to show up, despite the subpar rates and reimbursement you all quietly approve of based on the inaction each session. We continue to show up despite the often and unfortunate, disrespectful, combative, and toxic regulatory environment with the agencies. We continue to show up even when you all continue to ignore our calls to action, our pleas for help. We continue to show up until we no longer can. And then the system begins to crumble. Hospitals start to overflow. Emergency departments cannot see folks for dozens of hours. Individuals live in a hospital room for months on end. Sick and vulnerable individuals are placed in greater harm, and our system pays multiples on what it could if we could just support the organizations like ours do our job. And regardless of the department's inability or unwillingness to show projected cost savings in the often flawed fiscal note process, I can unequivocally state with absolute certainty that it is cheaper and better to serve someone in their homes than in a hospital or other intensive setting that they do not need to be in. So it's time to stop with the excuses, stop with the delays, and do something. We expect you to act. The individuals and their families we support expect you to act. Our teams expect you to act, and I beg you to act. And now, once again, you are elected to act, and you have the opportunity to sit in the seats and do something. And now is the time to do it.
Thank you, Mr. Berg, and we look forward to getting some solutions from you as well. Dustin Lee, Prairie Senior Cottages, welcome to the committee. And let me just ask a process. Do the cameras automatically shut off at 11:30, Senator Abler? Because there's that 14040G assisted living licensure conversation actually is going to be a pretty big conversation, but and I'm looking at it, and we really need to have an RCO update from the department as well, and Jody's still online. So.
Mr. Chair, I suggest you ask our crack staff, Mr. Lane. He is the expert on this.
Expert. So, Mr. Lane.
It goes till 12.
Oh, all right. Thank you. All right. Thank you, Mr. Berg. Welcome. Now, don't pull out your thesaurus and start going into a 20-minute diatribe there, Mr. Lee. Because we will give you the hook. Dustin Lee, Prairie Senior Cottages, welcome to the committee.
All right, thank you, Senator Hoffman and Senator Abler. I want to tell you, your interaction at the beginning of this committee meeting was an absolute class act. and it actually inspires me, and I hope that you take my comments today to reflect the spirit of the behavior that you gentlemen projected. Thank you very much. My name is Dustin Lee. I lead an assisted living company called Prairie Senior Cottages. We specialize in dementia care, and we serve rural Minnesota. The reason why I'm here today is I want to talk to you about our workforce crisis, and I'm really hoping that you can help us. As COVID has demonstrated, we are all interconnected, and we all need to support each other. All providers have seen people simply quit, and these people are not coming back. We're exhausted, and we are in a crisis, and we cannot solve this problem without you. Our product is our people, and when our people break, so does our healthcare system. At Prairie Senior Cottages, 52% of our customers are 100% dependent on the generosity of the taxpayers for their care. So to the taxpayers, I thank you. All of our customers are old, the majority of them are poor, and all of them have some form of memory loss. Today I want to talk to you in human terms regarding the trauma our frontline healthcare workers are experiencing. Just shy of 3 years, providers have been doing our best to protect our older adult population. From 2003 to 2004, I served in Iraq in a combat zone, where it took me over 5 months to receive my body armor. That was a traumatic experience. But the experience that I'm experiencing today is eerily reminiscent to what we experienced in Iraq. Our employees and providers are experiencing trauma and post-traumatic stress disorder. And again, this is nearly identical to what I experienced and witnessed in Iraq. While many providers, while many in the workforce have the luxury and safety to be able to work from home, providers did not. Providers were in the trenches with the troops. And not only did we lose many of our residents, we lost some of our colleagues. You might be surprised to hear that under the current regulatory process, as structured, is causing more pain and trauma in our workforce, further fueling the present crisis. It's the law of unintended consequences. Let me give you 3 examples quickly. The implementation of the new assisted living rules during the pandemic. We're still fighting a 3-front battle: COVID, implementation of regulatory reform, and an ever-increasing staffing crisis. Our staff are literally struggling in the deep end of the pool, and the timing of the implementation of new rules simply continues to push staff underwater where they can no longer breathe. The human condition can only take so much before it breaks. Number 2, the punitive nature of the survey process. At a recent public assisted living home care and advisory council meeting, department staff was discussing the department's desire to increase fines for providers. The staff cited an assisted living that recently closed, and the department thought that the provider who had closed should be fined. Their words were, "We need to increase fines and put more teeth in the regulations." The words "more teeth in the regulations" is a form of aggression. There should be no room for aggression in healthcare. And then number 3, the recent changes in the criminal background process. While I appreciate the commissioner stating that 85% of all checks come back within 24 hours, that 15% that does not come back is adding significant fuel to the crisis. In this situation, providers like myself feel helpless and hopeless. And again, people can only experience trauma so much. Now more than ever, we all need empathy and compassion as a foundation for solving our mutual problems and interests. We need to come together to solve this workforce crisis. We need an environment where providers and department staff at all levels have empathy and compassion for each other, where we are strategic partners and collaborators working together to provide a quality work environment, which in turn provides quality care. I trust you to be fair, and I trust that you'll receive this message as it was intended, with love, kindness, empathy, compassion, and hope. If you want to talk further on how we can build a better foundation that can better serve Minnesota's older adults, please know I and myself and other providers would be more than willing to come to the table. Senator Hoffman, Senator Abler, fellow senators, thank you for the opportunity to testify. Thank you very much for what you're trying to do.
Mr. Lee, thank you for your service, first of all, and thank you for highlighting the issue at hand that's there. Senator Abler? Nope. So, Andrea Best, are you online with us, or are you coming down?
I'm online, Mr. Chair.
Andre, I'm sorry, I got an A after here. I don't know what the heck I'm doing here. How are you? Nice to see you. Welcome back.
I'm well, thank you. Mr. Chair and committee members, as you know, my name is Andre Best. I'm the vice chair for the Minnesota First Provider Alliance. That's a statewide association of PCA provider agencies. I'm also the CEO of Best Care, a PCA waiver and FMS service provider. We already heard a little, but for further context into the challenges in PCA, I hope everyone had a chance to read that recent Star Tribune article titled "Man Loses Legs to Lack of Home Care" that was dated November 6th of this year. In that article, his sister said, "My brother sacrificed his limbs to the caregiver shortage." It's a sad but true statement, and what's most troubling about it is that it was avoidable and directly attributed to the inadequate PCA reimbursement and the corresponding wages. As many of you know, the PCA program is one of the lowest reimbursed services in the state and much lower than other programs that fill similar needs. And over the last 14 years, PCA reimbursement has only increased by $3.36. And if the reimbursement rate's low, the wages are low as well. I guess I want to keep it short for you all. And the bottom line here is that more than the current reimbursement rate of $19.60 is needed to sustain this program. So to address the workforce crisis in PCA and make the program sustainable, we need to do a couple of things. First, we need to do a better job of funding that PCA rate framework that was passed into law last legislative session to include cost-based adjustments to the reimbursement rate over time. That'll ensure these jobs can continue to be competitive. Second, we need to invest in the rate framework in a way that accounts for overtime because we're doing it and it's required a lot of times. We need to pay out overtime and we need a rate that accounts for that. Finally, we need to reduce the barriers to onboarding new PCAs. The time to affiliate, it still takes too long with the PCA agency. And I know the department is trying with the background studies, but we really need to improve that broken background study process. It's a real additional burden right now. Thank you so much for the opportunity to testify, and I hope we can solve these solutions together.
Thank you, Mr. Best. It's going to take all of us. I mean, we really need to keep that focused on. I appreciate hearing from you. Seeing no questions, I'm going to move on to the 144G assisted living licensure conversation. And then I'll come back and make some comments afterwards. But Commissioner, I think you have, actually, this is Department of Health that's doing this. Lisa Tomjin, Sharon Compton, Diane Redrick, Lindsay Krieger, right? Am I correct on this stuff?
Senator, this is Lisa Timian. I'm Legislative Director at the Department of Health. I do not plan to testify, but Diane Redrick and Lindsay Krieger are available.
All right, so thank you. And Sharon Compton, are you there as well?
I am here. This is Sharon Compton.
All right, Sharon, why don't you go ahead and let's welcome to the committee.
Well, thanks for hearing us today, especially on such short notice. I appreciate this. I appreciate Senator Abler and how he has been an advocate for us. And when we have a problem or a situation, he's always ready to listen. I also come to you today with a few solutions to some of these problems that will hopefully benefit in a very timely manner. First of all, the 144G licensing is beyond comprehension to even get it all done. And then it comes with so many fees, regulations, penalties, all of that. You could solve a lot of this staffing and financial crisis by getting rid of all of these fees. Let me give you an example. We are an assisted living. We have 65 residents. We have 10 houses. We operate as a family environment, trying to keep our people feeling like they're in a home, not institutionalized. We are allowed 5 to 10 people per house, depending on when we acquired the licensing. So that's another problem. Some of our houses can have 10 people, but in recent years, we can only have 5 in a 6-bedroom house. We could easily take on another person if they'd loosen up that restriction. But when you move to that 6th person, they want you to put in stainless steel countertops and all of this commercial stuff that costs a boatload of money, and you can't get a higher reimbursement on the caddy waiver. So let people expand these homes that can accommodate more people into, 6 or 7 people comfortably. If licensing back in the 90s worked for 10 people, why does it have to be restricted to 5 today? So we're grandfathered in on 3 houses or 4 houses for 10 people, but that's it, not the newer ones. The other thing you can do is stop putting the fear of God in everybody with all this licensing stuff, these penalties. I mean, we've got nurses in tears and crying that they're going to lose their licenses because they did something wrong. These people are human beings just like everybody else. And the poor guy that just testified earlier about the limbs that were given for the staff shortage, if you didn't have us chasing paperwork all the time and dotting our I's and crossing our T's to your perfection, that would go an awfully long way. We are over-regulated. We are so regulated that we cannot even spare the time to care for clients adequately the way we feel we need to do that. So I know you have other people maybe that want to testify in what's going on, but the fees, here's another example. We are one company, but we have 10 houses. So we've had to pay a licensing fee on every single house. That's about $3,000 a piece. However, another facility that has, let's say 120, 200 beds, they are one facility. They pay one fee of the $3,000, not $3,000 for every 5 clients. We've put out over $30,000 in client or in licensing fees. Unbelievable. We have no reserves left. And when we have a crisis, we have to close one of our houses and double up our other houses just to accommodate them. And then we're over the limit and then we're penalized. Well, good, take our clients away. Where are you going to put them? We're doing our best to meet everything. And we did not lose one client to COVID during the whole COVID crisis, nor did we lose any employees to it. We do an excellent job of caring for our people, and we want to continue doing that. So stop the regulations, put a moratorium on this whole 144G immediately so that people can function. We will do much better when we feel like we're all on the same page instead of feeling like it's MDH against the assisted living. This is a horrible, horrible industry to be in right now, and people are leaving it. So stop all the regulating. That is my solution to this. Loosen up, stop charging for every little thing, even the background checks. It's $9 per person to go get a background check. That's almost 3 gallons of gas on a good day. You can't keep mandating all this without funding. If the state can't come up with more money to pay on the caddy waiver and the elderly waiver, fine, we'll live with that. But then you have to cut somewhere else. That's economics 101. I understand we don't want to tax people more to pay for these facilities, but you cannot keep penalizing and taxing and over-regulating. 144G is out of control. And to give you an example, when they came out for the survey, they even wanted us to have a policy on what we would do if an employee pooped on the floor. And I kid you not, I have 2 of our nurses here, one of them that heard that statement, a policy for an employee doing that. How stupid. That is absolutely ridiculous to have that's just an overreach. That makes absolutely no sense. How about the food programs? We can't keep any leftovers. So if we make lasagna today, we can't serve it the leftovers tomorrow. We have to throw all our leftovers out. We can't keep any. So we cater in the Thanksgiving dinner. Guess what? They wanted to deliver it on Wednesday. Well, technically we should have thrown it out on Wednesday because it didn't get eaten. Well, we did serve it on Thursday, so slap us with a fine there if you need to. We did it. But even Byerly's and these other places, they're delivering Thanksgiving meals. You pick them up on Tuesday to eat on Thursday. They are still good. The waste is out of control. We are paying our home health aides $20 and $21 an hour to do the job. And everybody runs in fear that they're going to do something wrong. And then when a client gets hurt or falls or something, right away, it's a big investigation what we did wrong. Well, sometimes things just happen. So yes, we need help, but stop all the unnecessary regulating. You can stop that right now. You can immediately stop this 144G, put a hold on it, and let us catch our breath. We can't even get one survey done. That's the other thing. We're subject to 10 surveys. Other companies that have 120, 200 beds, they'll get one survey every 2 to 3 years. Not Whispering Pines, we have 10 houses. We're already on our second survey. We haven't even gotten the written stuff from the first survey to get everything corrected, so we don't even know what our fines and stuff are, and now we're on to the second one. Where does it end? You're driving us out of business. Yes, staffing's a problem, but regulating is driving the problem, so you need to stop it immediately. Thank you for listening and for all your service.
Thank you. Nice to hear from you again, Sharon Compton. Thank you. That's the reality of Whispering Pines over there by the railroad tracks in beautiful downtown, well, north of Anoka, I would say, Senator Abler.
Mr. Chair, I know we're out of time, but we have to, I am a fan of quality. I was part of the discussions about the 144G, but nobody meant this. No. And so with Mr. Chair, we and Representative Noor, it's on our plate. Yep. And so, Ms. Compton, thanks, we're on it.
Thank you.
You're good. Your much improved chair is going to lead the way to try to get something accomplished this time, where the other one just fell so flat. So.
You know, and to hear Senator Abler, you know, when you look at people with disabilities are continually sacrificing, right? That Star Tribune article, absolutely, my heart just dropped. And thank you, Andre, for bringing that back up. But this is a wake up call for humanity. I mean, this is what we're about. And yes, in our conversations with Representative Noor, and I know he's not on anymore, but that absolutely is something that you two are on, and I'm honored to be part of that conversation. Let's fix this. So, thank you with that, Sharon. Commissioner, can you give us an RCO update? Is that you that's doing that, or?
We have Christy Grom here ready to speak to that.
Yay, Christy Grom. Welcome to the committee, Christy Grom.
Thank you, Mr. Chair. For the record, my name is Christy Grom. I'm with the Department of Human Services. And I can provide maybe like a 5-minute update. Is that what you're looking for, given the time situation? Just trying to.
If you could scale it back, I mean, just give us, because we know we need to continue our work in this. And if you could just give us the higher level, you know, just where you're at, what's going on. Clearly what Senator Abler had talked about. So if you could do it in under 4, I'd appreciate that.
Okay, I will do my best, Mr. Chair. So on the RCO front, I will say we're very happy to report that there is quite a bit of positive energy at DHS as well as at MMB and among stakeholders both in the mental health and substance use disorder or SUD areas as it relates to RCO work, recovery community organizations, and more specifically around peer services. So we have a set of grant contracts that are about ready to be executed and will soon be distributed to the community. We know that that's important funding that RCOs are really looking forward to getting. We also know that we have a very thriving RCO community in Minnesota. I think we have one of the fastest growing RCO communities in the nation with around 18 currently existing RCOs right now, and more I think that are looking to get online and provide services to people who are in recovery. So maybe I can just share a few ideas that we're working through with stakeholders and in response to the MMB evaluation on peer recovery services that was released last summer. And so first, one of the things that we're looking to do related to kind of peer services at large, which kind of encompasses a lot of the RCO work that's occurring. Excuse me, slightly choking on something. First, we are looking at developing a state-based community-led credentialing process. So this is a body that would be established to kind of have a state-based. Right now we use outside entities to credential RCOs, but we want to bring that in-house and make sure that local voices are engaged in those discussions around our RCO community. This kind of is generated, this idea was founded in a lot of the conversations that started last session. So thank you very much to all of you for providing some ideas to get us going. I think we're looking forward to hopefully bringing forward some kind of proposal depending on what's in the governor's budget. And if it's not in the governor's budget, we'd love to work with all of you on making some reforms in that area. We are also looking to sort of align our policy direction with our work in the peer space, really integrating mental health and SUD peer services So we would like to integrate all of the standards that are variations across those different services, as well as the training requirements for those services. So these are things that we'll bring forward hopefully next session if we get an opportunity to, but we've been working with stakeholders on those ideas and would love to continue that work with all of you. Last year, we also brought forward a proposal that provided ongoing funding for peer training. That's something we're interested in supporting again this year. Another idea that we're looking at is expanding access to peer services. So we'd like to expand MA vendor eligibility for peer recovery services so that counties can provide those services, particularly to justice-involved populations where we're hearing there's a lot of need for support for those populations at the county level. And then lastly, we're looking at the possibility of allowing peer recovery services to be provided in group settings in SUD treatment settings. So that's a very, very high level overview of some of the ideas that we're working on. I'm happy to answer any questions or provide more specifics following the hearing. Thank you.
Thank you. And I know Senator Abler, that was something that we had worked on, you know, the things we moved last year and to enhance and support when the governor created the director position. There is now a director of that oversees addiction on the cabinet level. So Ms. Grom, we absolutely, the work that you and Mr. Burdick do with the elected officials is absolutely a top notch, and we look forward to moving this SUD mental health. I love the discussion of looking at collaboration or coordinating those efforts, the peers, you know, mental health, and because it's, hello, folks, there's intersectionality and co-occurring conditions that occur in the state of Minnesota. We just know the data's out there, and I like that conversation. So with that, I don't see anybody with a follow-up to Ms. Grom, but I do need to come back. I quickly, looking at the time, because, you know, I jumped ahead, and Lisa, Tim John, I apologize for skipping over the Minnesota Department of Health regarding the 144G assisted living licensure. So if you wanted to go ahead and either have Diana Rydrick or Lindsay Kruger comment, or sorry, I didn't have it down here in front of me. There you go. There's my mea culpa. So there, hopefully you can smile and say, yeah, I'll forgive you this time, John, but not next time. So.
Yeah, thanks, Chair Hoffman. And I'm hoping that in working together more this next session, you'll even get to learn how to pronounce my last name, which is Timian. So looking forward to that.
Say that again. Say it again. You only have to say it one time, and then I'll be done.
Timian.
Timian. All right, there you go.
Yeah.
There you go. Thank you, Miss Timian. Who do you got?
And Mr. Chair, I'll be happy to say a few words. And just for the record, since I didn't introduce myself before, I'm Diane Rydrick, and I'm the Assistant Commissioner for the Health Systems Bureau at MDH. And I will just say it has been a long time since someone pronounced my name right and got Lisa's wrong. So, you know, I've heard it all be correct here, and the multiple Y's always throw people off. So on that one.
Commissioner. All right.
So, thank you, Chair Hoffman. Just to quickly respond, you know, we really appreciate Ms. Compton bringing these concerns forward. And I know it is not just her facilities that are experiencing some of these challenges. We know a lot of, especially the smaller facilities that do more of the home style or family style assisted living, do struggle with some aspects of the assisted living requirements. And I think, as you know, Mr. Chair and Senator Abler, we got these questions in advance. We sent some responses to all of you and to Ms. Compton addressing these issues. And I think there are a number of misconceptions there that we clearly have more work to do to help people understand where there is flexibility on food code, on leftovers, on infection control, and a lot of things. So we are committed to continuing to do that education, and I hope we can connect with Ms. Compton afterwards to speak directly. I will say too, though, we would love to continue conversation around how to balance protections for residents and burden on smaller providers with the legislature this coming session, and we are happy to have those conversations with providers and advocates as well. I think it's important to remember that when the assisted living licensure law was passed, it was a commitment on all of our parts to make sure that we found the right peace in the valley, to use a Senator Abler longtime term, where advocates for residents and providers and the state all felt comfortable. And we felt like we had struck that right balance. And I think that's the only way we ended up getting a law passed that we did. And it's important to maintain that balance going forward. So we can't get rid of all regulation. That's not an option. But we can probably find a pathway that makes things a little bit easier for some of the smaller providers, whether it's financially, in terms of the food code requirements, in terms of some other pieces that are more painful for them. But we have to really make sure we're considering the voices of residents and resident advocates as well as providers as we go through that process. But we look forward to engaging with you on it in the coming session.
Absolutely, Assistant Commissioner, we need you. I mean, this is, we all need each other on this one, man. When you really look at that umbrella of what we're supposed to be doing for individuals in the state of Minnesota, we absolutely need each other, and so I appreciate that. I don't know, did Lindsay Kruger have anything to add to the Assistant Commissioner's comments or not? Senator Abler, any comments forward? I think there's some work that needs to, I'd like to see us.
Well, Mr. Chair, I just saw this piece of paper on my desk here with a bunch of numbers on it, a little chart, little spreadsheet thing. Is there some reason that you passed that out today? Yeah, so Senator Abler, thank you. When you look at the work we did as a committee the last 2 years, and we had a stabilizing bill last year that was well done here in the Senate, and the sheet you have in front of you is our legislative assistant Kevin Parker went in and we looked at it, saying, well, this is a priority for us as a committee. This is a priority for us as a state for this long-term stabilization, which included the Home and Community-Based Services PCA work. The bill that we passed here last year, it is my desire to take that, reopen it, bring it the first day we meet, and try to pass this out of this committee like by the 11th of January to show that this is a nonpartisan priority for the state of Minnesota. And so the work there is there's our base, and the numbers you have in front of you, members, there are just those items that we specifically looked at, workforce type issues, right? That's what we kind of pulled out there, Senator Abler. So it really is a base on that. So thank you for bringing that up. But as you know, long-term care and services, did you want to say something, Senator Abler, to that point, or? Well, just that I'm sure you'll be meeting with staff and the department to update the numbers to make them relevant to implementation now, since we're like a year later. But I think that's amazing. And I think it's a tribute to the work we've done here and the foundation we built, to the testifiers that go like, what are you going to do? Yeah. This. Yeah. We're going to do this. Put the bill out there again and actually make sure the people with disabilities and serious needs, this paper here, Mr. Chair, and I commend you for that. Thank you. I'm happy to be a part of that process. It's joyful work. And I know that Dennis and Liam had said that, they can't really get the right numbers until, or accurate numbers until there's a new forecast that comes out in like the second week in December or so. Is that correct? I mean, that's what we're waiting on that as well. That's what I know they're working on. So, Mr. Chair, just advice as the outgoing chair. Yeah. They're really smart. I always listen to them. And I heard that. I heard that. But the services, the struggle dates back way before COVID, Mr. Chair, and COVID just exasperated this issue that we face, right? And then in 2021, we saw the debundling, which occurred further strain and confusion to a system that we know, but we already knew in its fair share. Transportation, food, activities, daily living, space, and homes for independence, and more intensive care all were stressed past the point of survivability in some providers, which we heard today, as you know, folks. This in turn limits the options, right? We're supposed to be about informed choice. That's a federal judge has said that, right? And we believe that. And it's always been our goal that members of this committee address those challenges and services that people face, and expand upon the opportunities that are available for many as possibilities, right? More importantly, we need to expand the opportunity to experience the full breadth of life and the committee has to offer. So as the incoming chair,
that goal remains, and my passion for it only grows, Senator Abler, that we need to prioritize investing in our services, and key among those are increasing the competitiveness for hiring. These workers care. We heard it today, and it's enough said. Let's just do it. Let's make it a priority and hold people to the piece on that, because our most vulnerable, they should be able to care for their families and afford the opportunities that provide others, right? Number two, we really need to closely evaluate the processes in the system. You heard that today as well. And work with our agency and stakeholders to continue that streamlines how we provide services and find ways to enhance them, right? And then really, we need to look for the ways of accessibility for all Minnesotans, right? With a focus on intersectionality and equity, that no one is included, no one is excluded from the services that they need or deserve, right? There has to be that conversation of intersectionality, and now we can really lead the way in that. So, like you said 2 years ago, Senator Abler, that, you know, if there are new ideas on how to accomplish tasks or improve our system, I invite everybody to share those same experiences, ideas, and passions to help improve the lives of Minnesotans served by this committee on the systemic level. I mean, you set that. And so with that, I humbly am going to ask for people's help, from members of this committee, from the departments, staff, and all Minnesotans, right? Our work can't be done alone, period. It's all what we're a part of. So, you know, it is the work of the people and for the people. Thank you, Senator Abler, for everything. You know, I look forward to our continued work together. You know, by the way, I know where you live, and I know where you eat. That's supposed to be funny. My wife said, "You're not funny. Don't try to be funny, John." But your work on human services throughout the years, I would watch you in the House or the other body, right? That has impacted so many of our fellow Minnesotans in a positive way, and knowledge that you've gained other ways invaluable to all of us as we continued our work. And working with you has always been and will always be a privilege and a joy. And so it's not going to be easy work, but we know that everybody coming together as a team, as we gathered here, is going to protect and enhance people, the services for people in Minnesota. And so I thank you for being here. It's an honor to take the gavel into the new year as we work together and take on those challenges before us, as we seek ways to further enhance the lives of Minnesotans across the state. And so with that, Mr. Chair and members, I get to say we're adjourned.